Individual actually came to my attention because early on during the measles outbreak, I promised Governor Abbott to send some money down, badly needed money, and help down to Texas. And this individual blocked that money for a month. And I couldn't figure out what's happening. I gave the order. I'm running this agency. How come nothing's happening? And then we tried to get the vaccine safety data link, which is the data that supposedly the CDC tries to use to make good decisions on whether vaccines are hurting people and not whether they're side effects. For 7 months, he stonewalled us so that we could not get that data. He's also the individual that runs the VAERS system, which is the surveillance system for injuries, that captures, according to CDC's own study, fewer than 1% of vaccine injuries. This is malpractice.
Holy cow, folks. RFK Jr. lied a lot in that clip that I'm going to debunk for you. To start, the person in question that he's trying to blame all of the recent problems on was former director of the CDC's National Center for Immunization and Respiratory Diseases, Dr. Dimitri Daskalakis, and he completely mischaracterizes his role as well as what happened with that measles outbreak that started in West Texas. So back in late January, when the first cases of measles were being reported out of West Texas, there was an external communications pause placed on federal health agencies like the CDC, so they weren't able to communicate to the public their usual ways to be able to combat this measles outbreak, and they didn't have any boots on the ground until March, when we already had a bunch of cases exploding, and they sent 2,000 doses of vaccine down there, but it was like pulling teeth for RFK Jr. to say anything about encouraging people to get vaccinated, and already 2 kids at that point had passed away due to measles. Now, in terms of the vaccine safety data link, that is under the CDC. It is using medical records of patients, so it's not publicly available. You have to apply in order to get access to that data, and it's not directly under Dr. Daskalakis' office. It's actually through the Immunization Safety Office, so it doesn't make sense that Dr. Daskalakis would be able to somehow stonewall RFK Jr. and HHS from accessing that type of data. Lastly, when we talk about VAERS, that is run by not just the CDC, but the FDA as well, as a positive public reporting system, meaning anybody can access the data, anybody can put in a report. It is not necessarily verified data. Researchers have to go in, look at it, and then try to verify and see if there's any potential safety signals. But in general, the vast majority of adverse events related to vaccines are mild and are not going to be reported because everybody knows that if you get a vaccine, you're at risk of getting a fever and feeling crummy. A good leader would admit mistakes when they happen, as what has happened recently with the measles outbreak that did not get contained quickly because there was a slow federal response. Instead, what he does is he blames other people for the problems at hand, saying that everybody else is corrupt except me and I'm going to somehow fix it. But what he's ending up doing is causing a lot of additional distrust in the CDC that was unwarranted to begin with, and we're all going to suffer because of it.